Hi, welcome to this next instalment in our Coffee Break QI series. My name is Kath Richards and I'm a Quality Improvement Lead at Birmingham and Solihull Mental Health Foundation Trust. In this session, we'll introduce the Plan, Do, Study, Act PDSA cycle and talk about how we test changes in quality improvement. The three main principles of this session are to understand the importance of planning in PDSA cycles, how we use the learning of each cycle to build our confidence in our change ideas, and knowing when to implement a change. The PDSA cycle is part of the Model for Improvement. The Model for Improvement is a structured approach to making improvements in healthcare. The model prompts us to ask three questions when we're approaching improvement. So what are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make that will result in an improvement? And then it uses the PDSA cycle to test the changes that we want to make. The model relies on a collaborative approach of staff from all backgrounds and levels, and patients, family and carers being involved in answering all three questions and taking an active part in PDSA testing. PDSA stands for Plan, Do, Study and Act. It is an iterative cycle whereby you test your ideas on a small scale initially, and as you grow confidence in the changes, you adapt and scale up, only implementing when you're sure that change has led to an improvement. So for something to be considered a PDSA, we need to go through all of the stages. So firstly, we need to make a plan. So this consists of having an objective for the test, having a set of questions about what you want to find out, making a prediction about what you think will happen, and planning how you'll carry it out. So this is the who, when, where, and how you'll do it. And this includes a plan for data collection as well, so how you're going to measure the effectiveness of the test you're making. And then you have to do it. So whilst planning is really important, you want to move quickly into giving it a go. You'll learn more in the doing of a test than anything else. And really importantly, you need to set aside some time to study how the test of change has gone. And in the study phase, it's important to consider whether it went as planned and how did it match your predictions. And then we need to act. So do we need to adapt and run it again? Do we need to abandon it and try something completely different? Or are you ready to implement the change and possibly look to scale up? So making changes and improvement is about moving from hunches and theories to making changes that result in improvement as evidenced by the data that you're collecting. The PDSA cycle and iterations of change allow for sequential building of knowledge and understanding. We start with very small tests of change, do follow-up testing, adapting as we go, and once we're happy with the adaptations, we widen the scale of tests, testing in different environments, so for example with different team members at different times of the day. And it is only when we're sure that the change has led to an improvement and that we've been tested in all the environments that we need to, that we implement the change fully. So I wanted to show you this because this is typically how a lot of change is brought about in large organisations. So a group of individuals meet, and usually quite senior people, managers, senior managers, and they'll discuss and plan changes that are needed, possibly over several meetings, over several weeks and months. And then sometimes approval is sought and changes will happen. And changes will be implemented, and sometimes changes are implemented across whole systems and organisations. And sometimes that's absolutely right, and that's what needs to be done. But in QI, it looks a bit different. It looks like this. So in QI, to ensure that we're making improvements, this is the approach that's taken. Some time is spent planning, but quickly we want to move into testing changes in the real world. And this is where we use our PDSA cycles. And all the while we're measuring the impact of the changes that we're making. Sometimes then approval might need to be sought, and then we can implement the changes. And one of the natural outcomes of this approach is that it directly involves frontline staff. And often we hear that staff get dismayed by change because it's often done to them and it's often quite big and transformational. This is about starting with small changes combined with frequent PDSA cycles, and this helps to foster a culture of learning and change. Frequent team-led PDSA cycles and bottom-up improvement strategies go a long way in fostering a team environment. So it's important not to underestimate the importance of this process It empowers staff and develops a culture of change and improvement. So I wanted to show you this example of a project team who were ultimately aiming to reduce the length of stay for inpatients who were fit for discharge. So the team had some changes, some hunches about change ideas and theories, and one of those was the introduction of focused daily discharge planning meetings or touchpoint meetings. And then they decided to have a form alongside that would reflect the discussions of those meetings. So for their first PDSA cycle, they nominated one individual to lead on the daily meetings and to test the usability of the form to document it. They did this in one team for 1 week. Then they studied the outcome and realised the form didn't suit all their needs. They needed more of a multidisciplinary team, MDT, involved for the meetings to be effective. And there were some difficulties in completing the meeting and the forms on a daily basis. So in the second PDSA cycle, the team made some alterations to the form. They involved more of the MDT in the touchpoint meetings. They found that doing it with the wider MDT and doing it daily was too difficult, and so they reduced it to 4 to 5 times a week and decided upon the core clinicians that needed to be involved. And there were also some further alterations to the form that were needed at this point. So during their third PDS cycle, they made further alterations to the form, involved the core MDT members on the reduced amount of days. And the team found that they were happy with this form and the process, and they implemented this approach within their team. The fourth PDSA then was to scale up the use of the touchpoint meeting and form in another environment with a neighbouring team. The process and the form were utilised well within this team. There were some more adaptations that team needed to do in terms of multidisciplinary team attendance and the time the meetings were needed. But by using this process, the team members were fully involved. So much so that they led the change, really. It was tested in the real world, and when it did come to scaling up to a new team, the form was adopted really well. And this is likely because it was trialled and tweaked by staff in a similar area. So when running PDSAs, it's important to think about what size of test you want to undertake. This table is really helpful to understand what size of test you should consider doing and what should be in place before implementing a change. So it takes into account the degree of belief in the change, the cost of failure, and that could be financial or cost of resources of time and staff input, and really importantly, the will of individuals testing the change. It might be that we're really confident in an idea and the cost of failing is relatively small, but if people aren't on board, it's unlikely to be adopted. So the process of testing itself helps to support the adoption of a change. And lastly, I just wanted to touch briefly on the value of failure. So failure is not really a concept within quality improvement, because within every idea we have and every test we do, we're learning about the system we're trying to change. So we look to the great inventors and innovators and improvements. They don't give up when an idea doesn't work. They study and they learn from it, and they adapt and they improve. And Thomas Edison said, "I did not fail 1,000 times. I found 1,000 ways I have not to make a light bulb." So not everything you try and ever change is going to work, but as long as you're learning and understanding why, you're not failing. So if your test didn't work, you want to try and understand why that was. So was it the change was not executed, or was it that it was executed but it's not effective? In either case, we've improved our understanding of the change idea and our understanding of the system that we're trying to change. Thank you for listening to this coffee break session on PDSA cycles. If you want to find out more about PDSA or anything to do with quality improvement, please visit our Connect page where you'll find all our information, or please just email the QI team centrally. And if you're on Twitter, please follow our Twitter handle, because we like to shout out about QI, all the work that's going on, and share resources on there too. So thank you for listening.